restaurant with your friends and you're laughing, you're eating, and suddenly the lady at the table sitting next to you starts panicking. She starts grabbing her throat and gasping for air. Well, obviously she's choking, but you have no idea what to do to help her, so you freeze. Well, today I want to share with you the importance of learning 3 basic life-saving skills. These include CPR, the Heimlich maneuver, and being able to recognize signs of a stroke. The most difficult to learn of the 3 is CPR. CPR stands for cardiopulmonary resuscitation, cardio meaning heart, pulmonary meaning lungs. The act of CPR is restoring normal heartbeat and breathing to the victim. The American Heart Association, or AHA, reports that in 1903, Dr. George Cryle reported the first successful use of external chest compressions in human revival. And in 1966, the National Research Council of the National Academy of Sciences summoned a meeting resulting in the standardized training and performance regulations of CPR. Doing CPR is complex in that there's different steps. You have to be very cautious when performing them. So the Mayo Clinic illustrates doing CPR in 3 categories: compressions, airway, and breathing. The first is compressions. So you place one hand on the person's chest and the other hand on top. And you push down or compress at about 100 compressions a minute. The next step is to open up the airway. You do this by tilting the head back slightly and lifting the chin. You place your cheek and your ear near the person's mouth to check for breathing sounds, movement in the chest, and to feel their breath. If you don't feel the breath or see movement, then you move on to mouth. You do this by pinching the victim's nose and making a seal using your mouth and their mouth. You give one breath, lasting about 1 second. If you see movement in the chest, then you give the second breath. If not, then you repeat the head tilt, chin lift maneuver. You do cycles of 30 compressions and 2 breaths until emergency medical personnel arrives. On a child, however, when you do compressions, you only use one hand and you breathe gently. On an infant, you use 2 fingers for compression. The AHA reports that 88% of cardiac arrests happen at home, and bystander CPR doubles or even triples the chance of survival of the victim. Unlike CPR, the Heimlich is much simpler and can be done by most anyone. The Heimlich is used when there is a foreign object lodged in a person's throat. The Deaconess Associations Incorporation says that it was Dr. Henry J. Heimlich who invented the Heimlich maneuver, and the first successful use of this maneuver was in 1974. Since then, the Heimlich maneuver has saved over 50,000 lives in the U.S. alone. The Mayo Clinic describes doing the Heimlich maneuver in 2 actions, the first being back blows. So you use the heel of your hand and you give a back blow between the shoulder blades. The next, you lean the person forward and you wrap your arms around them and you thrust upward in the abdomen as if trying to lift them. You do cycles of 5 back blows and 5 thrusts until the object is removed. If the person is unconscious, it's advised to do CPR because the compressions can help dislodge whatever's in their throat. The healthresearchfunding.org claims that choking has claimed 4,700 lives in 2010, making it the 4th leading cause of death. 90% of choking deaths are children under 5 and 65% are infants. ScienceHeroes.com says that the Heimlich maneuver has been used to save celebrities such as Ronald Reagan and Cher. Unlike CPR and the Heimlich, recognizing signs of a stroke is not a hands-on procedure. The National Stroke Association defines a stroke as a brain attack, meaning blood flow is blocked from the brain, having the brain lack of oxygen, making the brain cells die. The American Stroke Association uses 3 characteristics to define if you are more susceptible of having a stroke. The potential of having a stroke doubles each decade of one's life after the age of 55. Strokes are most common in women than in men due to birth control pills, pregnancy, and chances of preeclampsia, which happens in pregnancy. If you have a family history of people having strokes, then you're more susceptible. And strokes are most common in African Americans due to their high risk of high blood pressure and obesity. The Centers for Disease Control and Prevention uses the acronym FAST to define the signs of a stroke. F is for face, meaning half their face will start drooping, so if you ask them to smile, their lips will start drooping. A is for arms, meaning if you ask them to lift their arms forward, one will start drifting downward. S is for speech, meaning that they'll start slurring and sound very strange. And T is for time, meaning if you see any of these signs, you should call 911 immediately. The National Stroke Association says that 800,000 new or recurrent strokes happen annually, breaking it down to 1 every 40 seconds. In summary, CPR is used to restore normal heart rhythm and breathing using compressions and rescue breaths. The Heimlich is used to dislodge foreign objects using the Heimlich maneuver and back blows, and FAST is used to recognize signs of a stroke. What these all have in common is they offer a better chance of survival for the victim.
So Sam, what did you think?
I really liked their topic because it's it can be useful to everyone, and it was a really strong speech because you were you seemed like you knew what you were talking about, so that was cool, and you gave interesting facts in there too, so it wasn't all just dry, and maybe I noticed that you kind of were swinging around a lot, and you didn't you were looking at the audience, but you weren't really it wasn't at people, it was just kind of to the back wall, so maybe those are two things that you could improve on. And I really liked all of your visual aids made sense, and they went with your speech, so that was good, so it was good to see.
All right, well, I'll agree with a lot of the things that you said. I think that you had it's a broad topic that you're doing, but you do it kind of as an introduction to these ideas. You find a justification for putting them together. I thought that worked reasonably well. There's a very good preview at the beginning of the speech. I think your introduction could be a little bit more involved and generate a little bit more interest, but I like the hypothetical situation that you use as an attention device. And it feels a little bit like you're rushing in the opening and you want to pace yourself a little bit more. And I think that there are a couple of places where you could add an example to make something a little bit more interesting. But on a technical level, I thought that you did an excellent job. It's clearly organized. There's just one place where I didn't think the transitions were effective, but the other spots I thought they worked really fine. I like the way you integrated the material into the speech, the research material that you had. I thought it was presented very effectively. I appreciate seeing the picture of Dr. Heimlich. I'm not sure. That might have been the one thing that I would have cut out. That wasn't as important as the other things that you had. It didn't hurt anything, but there were a lot of images because you had to build on each one of those points. And there's, here's one thing and then the next thing and the next thing. And so it's a little more complicated, but that is such a minor quibble. I'm sorry I even mentioned it at this particular point. I thought it was fine. So the visual stuff is all really solid. The delivery issues, I'm going to agree with Sam. You do look up pretty regularly, but you don't really look at people. You're kind of looking in the corner, looking at the ceiling, look at the back, looking down. So you're not always reading, but you're not always talking to us, and you need to kind of do that. That'll be the next step to get to for the next assignment. I think you're in good shape there. And you do start leaning on the lectern at one point or other. That's a little bit awkward. I thought the summary was excellent. Thank you.